Hi, I'm Callie. I wanted to take a minute and share with you our latest version of Ask Evidently. Ask Evidently lives inside Evidently, embedded into your EHR. It's a private, secure, HIPAA compliant way to interact with your patient data and your patient's chart. And I'll show you how it works. So I'm going to open up Evidently here. On this left-hand side, this is our patient overview. Now I'm going to go into Ask Evidently. And if you're not familiar, I'm actually an emergency physician and informaticist. So all the things I ask Evidently tend to be pretty emergency department focused. So I'm going to ask Evidently, tell me about, actually I'm going to say, tell me if she's been intubated before. Now, Jane Doe is a very complex patient, so somebody I'm pretty familiar with looking at in the emergency department. She's also a publicly de-identified dataset patient, so she is also PHI compliant here. I'm going to open our evidence, and now I can see on this left-hand side that yes, she was intubated many times. Now, one of the reasons I chose this question is because I used to get asked this when I was in residency all the time, and I hated it because it was so hard to find this information in a quick way in the emergency department. But now you can just ask Evidently. When you see Evidently present information in two panes like this, it's often so you can pull up evidence on the right-hand side and interact with the chart on the left. So on this left-hand side, I'm going to click on acute on chronic diastolic heart failure because we've recognized this as a concept. And now on the right-hand side, I'm pulling up all the evidence from her chart that's talking about that problem. And that's pulling the structured data, the unstructured data, you name it. And I can click on it and get to that original source of the information. So that was for the intubation. Now, I might want something a little bit more complex. I'm going to say, tell me about her heart failure treatment over time. And you can see I made a bunch of spelling errors. It's actually fine. It's going to do probably an okay job. I'm going to say put in table. So now it's surfing through the chart, it's organizing things, and it's going to present it to me in the way that I want to consume the data. Perfect. In a chart, just the way I wanted it. So now I can look at the date and the medication changes and any other interventions, in this case, like ultrafiltration or blood transfusions. So I'm going to go ahead and click on spironolactone here. And now I can see on the right-hand side all the evidence I need for spironolactone. One of my favorite things is actually talking to clinicians to learn how they use Ask Evidently to take the best care of their patients. We have clinicians using this to help flag care gaps that might go unnoticed, to help organize messy rheumatologic histories, and even to write prior auth letters. And I'm really excited to hear how you're going to use Ask Evidently as well.